Hello, good morning. My name is Dr. Amir Ahmed, and I'm the postgraduate student for Diploma in Diabetes for the take September 2016. And this is my individual task relating to macrovascular disease and diabetes. I will be recording this for 5 minutes, and I will try to talk as much as I can on the macrovascular disease and diabetes. So, as we all know that diabetes is a multi-system disorder, and it involves different organs in the body, and it affects the heart, it affects the nerves, it affects the eyes, and it affects the gut also. Regarding the macrovascular complication of diabetes, the most common complication which can arise is relating to the heart, which is either an ischemic heart disease or we can classify this into either an angina or myocardial infarction. So it's very important that the patients should be advised to maintain a good glycemic control to avoid this complication, and with adequate glucose control and with appropriate use of antihypertensive medications, we are able to achieve this in most of the patients. But people who have a bit poor glycemic control, they are more prone to have these this macrovascular complication. And it's been proven in many trials that appropriate use of medications, antihypertensive medication, especially the perindopril, calcium channel blockers, and also sometimes statin can provide good result with the decrease in endpoint mortality and overall mortality, and especially the cardiovascular complication. The next complication which I'm going to talk about is a stroke, which is also a major macrovascular complication of diabetes. And as all we know that poor glycemic control can again increase the risk of stroke in both young patients and in older adults. Stroke is basically divided into a hemorrhagic stroke, which means there's a bleed into the brain, and second is called an infarction, in which the blood supply to the brain is compromised. People who have hypertension, they are most prone to have a hypertensive bleed into the brain, and that's a result from inadequate control of blood pressure or non-compliant with the medication, or especially with the high glycemic high glucose levels in the blood. So we should always advise the patient to take their medications on time, to comply with the medications, to check their blood glucose regularly, and also to eat a healthy diet, which means either a diet rich in fruits, vegetables, or a Mediterranean or Atkins style of diet. The third complication, which is quite common in people with the diabetes, and especially with the type 2 diabetes, is peripheral vascular disease, which either is in the form of a limb ischemia, or it presents as a numbness or claudication kind of symptoms. So this is very important, because anybody who is presenting with claudication should be properly investigated, and we should always keep the differential diagnosis in the mind when we are going to diagnose the peripheral vascular disease. So people should have the proper ABPI measured, and anybody who has an ABPI less than 0.1 should be further investigated. And especially if there are any ulcers present on the limb or distal extremity, they should be properly examined. The ulcers can be in the form, ulcers are usually accompanied by also infection. So in this case, we have to refer to a multidisciplinary team, which comprise of a podiatrist, an endocrinologist, a diabetologist, a diabetic specialist nurse, and this multi-team helps to prevent the limb salvage, which is one of the major complications of the diabetes. And I must emphasize, after describing three major macrovascular complications, which are ischemic heart disease, stroke, and peripheral vascular disease, I must emphasize that first of all we should educate our patients towards the diabetes. In many countries, especially in the third world countries, there is a very less awareness about the diabetes and its complications. So I think we should educate our patients not only in the form of guiding them in the clinics, but also giving them leaflets and telling them appropriate websites which they can visit and find out about more about the diabetes and its control. Second important advice which we can give to our patients is the diet, and I think that's the paramount importance in controlling the diabetes. The patient should eat a healthy diet, and as I described in early part of my video, that patients should eat more fruits and vegetables, more salad, more fiber in the diet, and kind of a healthy carbohydrate, and they should avoid eating carbohydrate after 7 o'clock in the evening. In the diets wise, I will recommend that either a Mediterranean style diet or Atkins diet are recommended, but there are different, these are different in different parts of the world, so every patient is different, so I usually advise to eat as much healthy as they can. Third is a compliant with the medications and regularly checking the BMs, which is very important. Many of the patients, when they come to the clinic, they tell us that they are not taking their medications on time, and this can result in poor glycemic control, poor hypertension control, which can result in macrovascular complication of diabetes. So our emphasis should be on the patients to comply with the medication and try to take the medications on time and check their blood glucose or blood pressure either by the nurse, or if they got any apparatuses in the home, they can monitor themselves. The fourth important advice is the follow-up. Regarding the macrovascular complication, most of the patients should be followed up in the clinics. For example, if some patient has an ischemic heart disease in the past, he should attend a cardiology follow-up clinic where appropriate consultation should be given for further management of this disease. And the patient shouldn't be lost in the follow-up clinic. They should attend regular screening. They should attend annual foot screening, annual retinal screening, and if they have an ischemic heart disease, they should have regular ECGs and to be seen by a specialist. In addition, I think it's not only the role of physician. I think in multidisciplinary team, diabetic nurse, the diabetologist, the endocrinologist, the cardiovascular team, which comprises of a consultant in cardiovascular medicine, the podiatrist, the microbiologist, the vascular surgeon, if we are thinking about the limb ischemia, they should also all play their role in protecting against these macrovascular complications, and especially the limb salvage, which is one of the dreadful complications of diabetes. So I think in the end I should emphasize that a team can work much better than an individual in controlling the diabetes, and the team also comprises of a patient, so we should always consider patient in the team also. So my take-home message is, it's a multi-system disorder. Don't take it easy. Try to educate your patient as much as you can. Please, if patients, please comply with your medication. Regular monitor your blood sugars. Avoid eating any unhealthy diet, and make sure you eat a lot of fruits, vegetables, and healthy fat and carbohydrates in your diet. Thank you.